My name is Aryan Pradhan, and for my Physics 107 final project, I chose the movie A Beautiful Mind. The character that I chose from A Beautiful Mind was named John Nash. He is a student who arrived at the Princeton University in 1947 off of a Carnegie Scholarship in mathematics. He strove to publish a new idea following a older economic principle, which led to an appointment at MIT in 1959. Following the years of his appointment at MIT, he joins the Pentagon in order to help decrypt communications coming through from possible Soviet spies. While working at MIT, he receives a new assignment from a new supervisor from the U.S. Department of Defense, William Parcher, and this new assignment has him looking for patterns in common magazines and newspapers to thwart a supposed Soviet plot. Because of this assignment, he becomes increasingly obsessed with looking for patterns to the point of him needing hospitalization at a psychiatric hospital after having fear for his life from supposed Soviet spies at a guest lecture while he was at Harvard University. My diagnosis of John Nash's condition in the movie is schizophrenia. According to the DSM-V, schizophrenia is a psychotic disorder which involves several dysfunctions ranging from behavioral dysfunctions to cognitive and emotional dysfunctions as well. Schizophrenia itself is a long-term mental psychotic disorder in which relations between thought, emotion, and behavior are broken down. These breakdowns lead to hallucinations, delusions, disorganized thoughts, abnormal motor behavior, and/or negative symptoms. Hallucinations are experiences of perception that occur without the need of external stimulus and can occur in any sensory perception, with visual and auditory hallucinations being the most common in relation to schizophrenia. In the film A Beautiful Mind, two symptoms that support the diagnosis of schizophrenia in John Nash are his hallucinations and his delusions. The hallucinations that John Nash perceives in the movie are his roommate at Princeton, Charles Herman, his roommate's niece, Marcy, and his supposed supervisor from the U.S. Department of Defense, William Parcher. The delusion that Nash has in the film is the contract he has with the U.S. Department of Defense in order to thwart a supposed Soviet plot of bombs somewhere being planted, and his assignment being to decrypt codes that were appearing in common magazines and newspapers. This delusion was shown to be a delusion when his wife in the film went to his drop location and found all of the files that he had dropped were left unopened, leaving John Nash to have a breakdown of sorts while he was processing the information. One symptom of schizophrenia that I was not able to find to support the diagnosis in the film was any form of disorganized speech or abnormal motor behavior, as John Nash in the film was a rather quiet figure who did not speak much unless he had something meaningful to incorporate to the story, and thus I do not see any form of disorganized speech or derailment or incoherence. For schizophrenia, one of the more common treatment plans that people affected with schizophrenia do is taking antipsychotic drugs for a open-ended amount of time. Usually this amount of time lasts till the end of the patient's life, and along with the drugs, taking part in some form of psychotherapy so that the symptoms of schizophrenia are able to be combated. The usual outcome of participating in psychotherapy and taking the drugs alongside the psychotherapy is lowering the symptoms of schizophrenia to a manageable level for the patient so that they may attempt to live a somewhat normal life despite the circumstances. This treatment is appropriate for schizophrenia because as of this moment, there is no cure for schizophrenia. Thus, the best thing that can be done for the patient is to help lower the symptoms of schizophrenia to manageable levels for day-to-day life. One of the ethical concerns that comes from a treatment plan primarily of drug use is possibly having the patient become addicted to the drug that they are taking in order to combat the symptoms, which could lead to either overdoses from a patient taking too many of the drugs if they are addicted, or possible withdrawal symptoms if the drug becomes unavailable to the patient for some extended period of time, which could then lead to withdrawal episodes, which could lead to harm to either the patient or those around them. Another type of treatment for schizophrenia is electroconvulsive therapy, or short form known as ECT, which would incorporate electrical shots to the brain of a patient through electrodes placed on their head. This therapy would have multiple sessions of ECT being performed per week for several weeks until improvements are seen, either through physical observations or through research conducted on the patient. Electroconvulsive therapy was actually the form of therapy given to John Nash in the film A Beautiful Mind, along with antipsychotic drugs to counter the hallucinations and delusions that he was facing in the movie. I believe the portrayal of John Nash having the psychotic disorders of schizophrenia was both accurate and inaccurate at the same time. I feel that it was accurate in portraying the effects of what a schizophrenic patient would be affected by the disorder, with having a reduced level of work being accomplished after the onset of the disorder, as well as the changes to their lives that would be made. However, I do feel it was inaccurate in portraying the actual symptoms of schizophrenia with the hallucinations and delusions being a bit too grandiose in order to fulfill the storytelling that is needed to be found in films and media. I feel that disorders portrayed in film are actually rather similar to what people believe disorders to be like in general, and I believe that films influence a good amount of what we think a disorder may appear, because that is the few examples we have of what a disorder would be like. I believe culturally, schizophrenia is a disorder that has many stigmas attached to it, such as that the main stigma of the past was that those that had schizophrenia needed to be separated from the general population because they were deemed too dangerous to be around the general population. And I also believe that not all cultures diagnose the disorder of schizophrenia because of the shame that some may face for being diagnosed with such a disorder in their culture. Thank you for listening. This has been Aryan Pradhan. Have a good day.